can be with us to join us today. Can I start by acknowledging today that we are all meeting on Aboriginal land, Aboriginal or Indigenous Torres Strait Islander land, and pay our respects to elders past, present and emerging, and acknowledge the important relationship between land and home that Aboriginal people have, Indigenous people have in this country. I think an important acknowledgement in a forum like this about homelessness and the process of reconciliation in this country is still an ongoing one that needs a lot more work, particularly in relation to the homelessness that so many of our Indigenous brothers and sisters in this country experience. So with that acknowledgement, I just wanted to also pay, I guess, acknowledgement of the great work that so many people in the homelessness sector are doing right now across Australia. Housing very much is about healthcare. We know that. That's what this forum is going to cover, but we know that housing is such an important response into this COVID-19 pandemic that we're facing, and some pretty extraordinary things have been happening in this country in the last few weeks. And we're going to talk about that through this forum and where we think we need to go next. So thank you to everyone who's on the front line as part of this battle, people who are on this call that are working in homelessness services, where whilst the worst element of this pandemic hopefully are behind us now, there was some pretty scary times in recent times, and just really wanted to acknowledge that it was frontline workers who were supporting people who are homeless that were going to work every day, putting themselves in harm's way. And so in a forum like this, we wanted to really acknowledge the work and the important work that you're doing, that homelessness really has been on the front line of responding to this pandemic. So the format for today is we're going to hear from a few different speakers. So Paul Flatau from the Centre for Social Impact at the University of Western Australia, he's going to speak about the progress we've had in ending rough sleeping to date. And as I was saying, there's been some phenomenal work done around the country, and he's going to share some of what we've learned about that. We're really lucky to have Nicole Bartholomeusz from the CEO of Cohealth in Victoria, who's going to say a few words about health and the case for the health response in responding to rough sleeping, and why we think that there needs to be a focus on ending homelessness. We're also lucky to have Cameron Parcell, Associate Professor from the University of Queensland, who's going to say a few words about the social and financial case for ending rough sleeping. And then Karyn Walsh, who's the CEO of Micah and Chair of the Australian Alliance, is going to give us a bit of an update and questions on what we've heard. Then there's a great chance for you guys to ask some questions. So everyone in the audience, have a think about what they are. There is a Q&A function. Please use that. Please post those questions as we go along. Unfortunately, there is quite a large number of us on. We've had almost more than 200 or so registrations for this event. So we can't turn on your video and audio just because it's a bit hard to manage. But please pop those questions in the Q&A section, and we'll do our best to answer those either in the Q&A time that we have allotted, or I'll ask some of the speakers to feel free to engage with answering some of those questions while the forum's going on. So this is very much an opportunity for everyone to learn from each other, and for us to brainstorm about where do we go from here, and consolidate what we've learned over these really rapidly changing last few weeks. So that's the kind of agenda. And then we've got a couple of call to actions and conversations that we can have about some great work that's being done by some of our peak bodies in Australia at the moment, and the campaigns that are happening. So to wrap up with a bit of a reflection on that. So that's the agenda. I just wanted to really quickly take you through a bit of background on the Australian Alliance to End Homelessness. We're what we describe as a community of practice, who are communities around Australia committed to the goal of ending homelessness, all forms of homelessness, but starting with street homelessness. And we've been doing a lot of work using what we call the Australian Zero Homelessness approach, sometimes called Functional Zero. And we've done a lot of work on that over a number of years across Australia. And the organisations you can see on the screen are the ones who've really championed that in different places as the leads as part of the Australian Alliance, but of course many organisations in different communities. And we're really about focusing on how do we end street homelessness, and using a methodology that's been really successful in other parts of the world. So some of the work we've done is building Registry Week or Connections Week's toolkits to go out and make sure this really revolutionary idea that we know the names and needs of the people who are in our community, so that we can do something about that. And as this pandemic has shown, that understanding of the names and needs, brought about through a common assessment tool, which we call a VICE for that, has been so helpful in communities responding to this pandemic. Knowing who is out there, how many people and what their needs are, has been very helpful for many communities to be able to rapidly shelter so many people in a really short period of time. So that's the focus of our work. These are the different campaigns that we've supported around the country as well. And we're really excited to invite more and more organisations and communities to be part of the work we're doing to try and end street homelessness. And we don't think that there's been a more important time to do that than right now in the light of this pandemic. So if you're interested in learning more about our work, please get in touch. One of the key bits that I always like to share about the work that we do is it gives us a way to measure what's going on. And this is just a very quick diagram to show how we measure functional zero, or the outcome that we're trying to get. And obviously the outcome of ending homelessness is something we can all agree on, but how you measure that differs between at a point in time. And this functional zero approach, where you measure all of the people coming into a community system and all of the people going out, and how many people have been categorised as being temporarily sheltered, which is the thing that we have done very significantly well in the last few months, few weeks in Australia. Ultimately, the goal we want to get to is people who are housed, and that means homes with support and housing, not just housing on its own, which is what this sort of temporarily sheltered category is. So that's really the method that helps us, what tools we've developed. And so with that, I'm happy to talk about all of that methodology in the Australian Alliance later on as part of the Q&A session, but we really wanted to hear a bit of an update about what's been going on out there since the last forum we had. And we're really lucky that Paul Flatau has been doing a lot of work on this. So Paul, if you're there, if you're able to turn your video on, and Mike can take it away.
Great, thanks for that, David. And yes, there's been a huge amount of work that's going on around Australia. So I'll talk a little bit about that, and others will talk about the health issues. Cameron's going to actually talk more about the economic and social case for ending rough sleeping and the implications of all of this work that's currently being done. But what we saw was a very immediate response from around Australia in terms of both rough sleeping and homelessness generally. And it was both immediate and very strong, particularly in some states and some regions. First of all, there was a public health response. You know, what do we do here? Because as Nicole will say, we know that there are a significant number of rough sleepers with chronic health conditions, and so they were particularly vulnerable in terms of COVID-19. And we also saw that the sector, governments and homelessness services moved very quickly in terms of getting public health guidelines out. And that applied to those who were in supported accommodation as well. So that was a very quick response. Now, what happened then in March, going into April, was that there was funding provided across Australia to support rough sleepers in particular, but those experiencing homelessness more generally, to provide immediate transition into temporary accommodation. And so that resulted in a very significant number of people who moved out of a rough sleeping kind of condition and other forms of homelessness into temporary accommodation. And at the moment, we're looking at well over 1,500 rough sleepers and more than double that in terms of those experiencing homelessness more generally, transitioning to temporary accommodation. Now, that's the biggest transition we've ever seen in Australia. And what obviously we want to do is build on that going forward. So just to give you some of the numbers that we've got from the various partner agencies. So for example, Launch Housing and other agencies like Sacred Heart Mission, Salvation Army and others in Victoria, we know that up to this point in time, 870 rough sleepers have moved into temporary accommodation. In New South Wales, from Nehemiah, their estimate is probably around 2,000 in total have been moved into temporary accommodation. And there's a very specific program around rough sleepers in Sydney, where in April alone, and this is on top of some numbers in March, we saw 258 rough sleepers. In Brisbane, April has been a very, very busy month. Over 500 people have been provided with temporary accommodation, of which 286 are rough sleepers. And in South Australia, a total of 400 as part of these programs. A vast majority of those are actually rough sleepers. So across Australia, this has been an amazing kind of response. In Western Australia, another 75. A new program announced in Tasmania in the last couple of days. ACT is a program in place. So you've got around Australia this incredible response. And obviously, the Australian Alliance to End Homelessness agencies, but more generally, right across the homelessness sector, comes this question, well, what are we going to do now? And we're seeing the transition of people into other forms of accommodation across every single state and territory. South Australia has been particularly effective in lining up permanent accommodation, permanent housing for those transitioning out of that hotel environment and into permanent accommodation, permanent housing. That's what we want to see. And this will represent for Australia the largest homelessness response in terms of ending rough sleeping we've ever seen. If we can build off this platform and ensure that people are not just moved back out into the streets if they're rough sleepers after a very short period of support, and we know in various places that support has been extended. It's not just a 1 month at most or 5 nights at most. It has been extended in a number of places. If we can then transition straight into permanent accommodation, and the housing market is probably, it's the best time to do it right now. And on top of that, Kate and others are going to talk about how we can use this time to build a stimulus package for housing supply to maintain this over time. So I think I'll finish at that to say a huge amount of work has been done. We've got a great platform. We can move forward to one of the largest movements of people into permanent accommodation, permanent housing that we've ever seen. Thanks a lot, David.
Thanks, Paul. I mean, and that is something I think we should be incredibly proud of that it's happened. I think that is an important, I would describe as first step in this response. I think that, you know, the more we can go out there and talk about this to the broader community and show that this is a wonderful response to this crisis and that actually the problem of homelessness isn't intractable, that you can make rapid progress, and we have just done it. We have made history in Australia in the last few weeks, and we need to now take that next step, support people into homes rather than just in shelter. So incredibly important achievement. Thank you, Paul, for sharing with that and for doing that work to pulling together that data. So obviously this is a health crisis, and we thought it would be really great to have somebody who's right on the front line of working between health and homelessness. And Nicole, you've done that for quite some time, and we're really excited to hear what you've got to say, and please join us.
Thanks, David, and thanks for the invitation to join the forum today. I've got a slide presentation, so I'm going to take over the screen and get that going. Okay, so just a little bit about Cohealth. So we're one of Victoria's largest community health services. We provide health and wellbeing services to marginalised communities. So we're not a housing provider, but we obviously work very closely with housing providers to provide wraparound health services to the homeless community. So we know a lot about homelessness and ill health. The evidence shows that people who are homeless experience significantly poorer health, both physical and mental health, than other Australians, and that life expectancy is greatly reduced compared with the general population. And you'll see I've got some statistics on the slide there. A 2016 Australian health audit found that people without secure housing reported both physical and mental health conditions at twice the rate of the broader population. So not only do homeless people have poorer health, the fact of being homeless significantly contributes or complicates the care and treatment that they require. People experiencing homelessness have significantly less access to health services than the broader population. And the barriers to accessing health services means that it's more likely that health conditions will exacerbate, become more acute, and be combined with comorbidities. This often leads to longer and more expensive treatments in tertiary settings. And we also know that there is significantly higher rates of presentation to the emergency department from the homeless community. So add to an already challenging health situation is a pandemic. So the next slide shows the health footprint of a pandemic over time. And as you can see, the impact of a public health crisis like we are currently experiencing goes well beyond those who are directly infected. Whilst the first wave is categorised by the immediate health response to the pandemic, you can see from the graph that waves 2, 3 and 4 show how the restriction on health services as a result of that immediate pandemic response will exacerbate the impact of other urgent or chronic conditions over the long term. And this is a slide for the general population. So you can imagine the impact for people who are homeless. The exacerbation of chronic conditions is far greater. And with the ongoing impact of psychological trauma and poor mental health, the impact will be felt for far longer. When we look at COVID-19 and homelessness, there is a disproportionate impact for people who are rough sleeping. The lack of secure housing makes it impossible for rough sleepers to self-isolate, and therefore puts them at significantly higher risk of contracting COVID-19. This very vulnerable community are at a much higher risk of serious illness or mortality due to the likelihood of pre-existing chronic conditions. As Paul mentioned earlier, the Centre for Social Impact describes that around 2/3 of people sleeping rough have at least one chronic health condition, and this places them at higher risk of developing severe case of COVID-19. Those other health conditions will mean that the secondary impact of restricted health services at a time whilst we're responding to the pandemic will be disproportionately felt by this community group. The temporary suspension of some social support services, such as access to showers, could also create or exacerbate health conditions. If we start to think about the lifting of restrictions, there's growing sentiment across Australia that this may occur soon. At the same time, there is a clear moral obligation and health imperative not to force people to return to sleeping rough. Most modelling suggests that we will see second waves of infection, including the development of hotspots as we begin to lift restrictions. On the street, rough sleepers would again be at greater risk of contracting and transmitting the virus, which in turn increases the risk for the broader community. So taking a health equity lens, it would be a mistake to forget that people experiencing homelessness have poorer health outcomes outside of pandemics. Beyond the clear moral obligation to address that inequity, ending rough sleeping would take pressure off the health system more broadly. Australian and international studies show that supportive housing models lead to significant reductions in emergency department presentations, lengthy tertiary treatment, and psychiatric admissions. Rather than returning to the way things were, this is an opportunity to find enduring housing solutions and end rough sleeping in Australia. But more importantly, it's an opportunity to improve the health outcomes of this very vulnerable community. We should be seeking to ensure that permanent, secure housing is available for everyone. Cohealth would also like to see greater investment in health and social support services that can wrap around people with complex needs. We have seen unprecedented cooperation between governments, so now is the perfect time for national leadership on housing and health equity. Thanks, David. I'll hand back to you.
Thanks, Nicole. That's great, and I think really interesting to see, to hear that health perspective and see some of those graphs. I put in the comments while you were talking that we'll have copies of the presentations available afterwards. So that understanding of those different waves and having a good sense of where we potentially could be going was really helpful. And I really want to remember that we're not through this yet, and that there's a lot of water to go under the bridge yet. So thank you for that. Karyn, keen for you to join us and share a bit of your wisdom with us if you can.
G'day, David. Really pleased to be here. It's astounding to see 185 people joining. It's a great pleasure, and in lots of ways, I've got a task that's both really, really easy, but also really hard. It's really easy because there are so many social and economic reasons for why we should end rough sleeping. So it's easy to talk about them, and many of which most people here are going to understand, but it's challenging to try and get through all of those in a coherent way in less than 8 minutes. But I'm going to do my best. And I was thinking about it as Nicole and Paul spoke. There are at least 3 levels of social justification for ending rough sleeping. And there's the individual level. And the individual level, of course, is really important. And it's important in a way that's often not recognized. And that is, what we know is that over and above the health consequences that Nicole beautifully outlined, we know that sleeping on the street comes with a whole heap of other personal costs. It means being dependent upon others. It means being dependent upon others for getting a wash, washing your clothes, getting a feed, getting a drink, going to the toilet. This is really at odds with how people living on the streets see themselves. They want to be seen as independent and capable in the same way as that we all do. And really, sleeping on the streets forces people into a dependent relationship where they become passive recipients of someone else's care, often voluntary care, irrespective of the positive intentions of those who are helping. So it really forces them into a situation where they're dependent. But what it also does, it kind of confirms this idea that they're different and they're in need of our care. We see them there on the street and we have to go and do something for them, rather than them having the capacity to control their own lives. And what we've found when we've done research with people who had lived on the streets for some time and moved into housing, they really described having their own place, sometimes a very modest studio apartment, but having their own place as an opportunity for them to take some control over their lives, but also to see themselves in a way that reflects who they feel deep down, and that is just ordinary Australians, just ordinary people. Over and above the individual level, we can also think about a system level too. Research that we've done in Australia and many of our collaborators and colleagues in Australia, consistent with the international data, demonstrates that when people sleep rough, particularly when they sleep rough for a number of years, it really first and foremost demonstrates our systems and our societal failures. Many people who spend years of their lives on the streets are actually a consequence of a failed social system. They're a consequence of a failed welfare state. We know that there are many, many, many points in their lives where our society has failed them. And often people living on the streets will describe those failures starting from childhood. They'll describe poor experiences as infants, as children, failed child protection and health systems, failed education systems, and then the list goes on. So we have to think about the systems failures that rough sleeping represents over and above the housing failures, which we can talk about in a little while. But what's very, very important in Australia, and particularly in Australia, a very, very wealthy country with an advanced welfare state with highly skilled practitioners working across the health and social service system, is that when people sleep rough, we do lots of stuff. We provide an awful lot of services to them, a whole lot of interventions, and as Nicole's outlined, a whole lot of interventions that achieve suboptimal outcomes, particularly when people are treated with the highest quality medical care and then return to the social conditions that make them sick. But what we also, and Nicole alluded to this, is that when people live on the streets, they use a whole heap of services that are essentially a consequence of their poverty. Now, that's not only bad administration and an inappropriate uses of our service system, it also costs an awful lot. So we tried to test this, and we built on work that Dennis Culhane and others have done in the United States. And what we did with 41 people who were permanently housed, they were secure tenants of Brisbane Common Ground permanent supportive housing. And we said, can we get your administrative data? We want to find out all of the services that you used, all of the government services when you lived on a street for a year. And then we want to know all of the services that you've used in the first year you've been a tenant of permanent supportive housing. And what we did is we accessed that data and we identified from the government how much all of those services that people used in the 2-year window, the first year when they were on the streets, and the second year when they were tenants of housing. And we wanted to figure out whether it cost more for them to be on the streets than what it did for them to be in permanent supportive housing. Now, some of you will have heard me talk about this previously, but what we found was astounding. It was astounding for lots of reasons. The first reason, and most centrally, was that when people lived on the street, on average, each individual used about $48,000 worth of government services. Now, this is not predicted use. This is not something we theorized or put into a model to kind of predict. Rather, this is actually the services those individuals used, averaged out. $48,000 per person per year whilst on the street. Now, for those same individuals, when we did nothing else in their lives, we didn't give them case management, we didn't give them an intervention, we just gave them permanent supportive housing, those very same individuals in a year on average used $35,000 worth of state government services, and that includes the costs of providing the permanent supportive housing. So what we can see that there is a cost offset of about $13,000 for getting people off the streets, particularly people who have been on the streets for years and years, and getting them into housing. But what we also found was that the complexities of our service system and how governments operate and how policymakers operate, and the challenges in addressing homelessness from a strictly cost offset or cost effectiveness lens. What the research demonstrates, similar to what others have done, is that the costs are borne evenly, or the benefits are not shared evenly across government departments. Some government departments benefit greatly from people being removed from the streets into housing, whereas other government departments are the ones who pay for that. So we have to think about the case of ending rough sleeping, not at a Department of Housing or a housing system level, but rather across the whole society and the whole state. Think about the connections between the domains of government departments. And this is a kind of a fantastic segue into the phenomenal work that Paul mentioned earlier that's been achieved in Australia over the last couple of months. The 1,500 people that have been accommodated represents something that is truly astounding. And what we need to do is think about, what's going on here? And what's going on is, there are lots of layers to that. And I've only got about 1 minute left, but what I want to talk about is that the health urgency that have pushed governments, and really governments have been pushed, the health urgency that have pushed government to get people into accommodation, well, those health concerns have been a reality for all people who are homeless and those who live on the streets. We know that living on the streets expedites poor health and accelerates death. So we need to think about the health consequences of rough sleeping all the time, not just when there's a crisis on. But more optimistically, how can we take the excellent collaboration between the state funding and the service sector in Australia? How can we take the excellent successes of getting people off the streets that we've seen in the last 3 weeks and scale them up? What we really understand, and many people have appreciated this for a number of years, is that homelessness exists in Australia, and there are great barriers for people to exit homelessness because we have systems failure. We have structural problems within our housing market. How can we take the lessons that we've learned from the successes over the last month or so and scale them up to disrupt the fundamental structural problems within our housing service system? And I think this is a great challenge that we all need to be actively pursuing now. And I'm really excited to be a part of the Alliance and the conversation with the myriad of people across Australia right now to try and pursue this. Thanks, David. Thank you all.
Thanks, Cameron. That was wonderful. And thank you for squashing so much into a short period of time. But, some really interesting points there. It always astounds me that when you talk about that research that you did, that the $13,000 offset, that actually costs us more to leave people homeless than it does to actually house them. It makes it so much more frustrating that we haven't solved this problem. But you give us some really great insights about, how this is a problem that needs all parts of government, all levels of government to work on. And that's why it's so important that we're all working together in collaborative ways. And shows what's possible when we've taken the action we have in the last few weeks. So our final sort of speaker as part of this first part of today's forum is Karyn Walsh. As I mentioned before, Karyn's the chair of the Australian Alliance, but also the CEO of Micah projects in Queensland. And Karyn, if you want to unmute yourself and have a chat with us now, that would be great. Thanks, Karyn.
Hi, everybody. Am I unmuted?
No, you're good.
Sorry. It's great again to see so many people joining us, and I think that Paul gave the numbers that showed extraordinary effort of, first of all, homeless service providers being frontline in this pandemic, and the mutual reinforcement that Nicole stated through health of needing to work within a health context of a pandemic as well as a housing crisis context, because so many people have had to leave not only where they were couch surfing or staying with friends or family, the impost of the directive, public health directive of self-isolating and not overcrowding and having this being enforced by police has meant that many people have not only been rough sleeping that have had to get housing, but people who are in overcrowded houses. And I'm sure, and I've spoken to people in other states where, this issue of the invisible nature of homelessness in our communities sometimes, because people are moving between staying with friends and family, sleeping rough, coming into emergency accommodation, that dynamic has really come to the fore for us to see. And now, like in Queensland, we've got over 640 people in hotels, and other states have got large numbers too. So I know that we all feel that this is a great opportunity, and we really love listening and learning across states about what are some of the strategies that will make it more possible for us to ensure that we just don't say the pandemic's over and the health risk is over, although I think it was shown to us very clearly that it's not going to be over even when the social isolation restrictions change. It'll just go into a different form and a different way. So during this time, how can we work in our local communities but be supportive through a national network? And I know for us, having the work done and the training done around the know by name lists and the methodology is something that we're really finding helpful. We know that out of that 640 or so people in motels, a percentage of them were known to us before, 40% were known, others were new, some were inactive, some we had known 2 or 3 years ago, but have represented. The housing department has a list of people that they're now funding in the hotels in the hope that we can move over the next couple of months in a way that identifies where people can go permanently. While we're doing that on a one-to-one basis with each individual or family, we know that systemically we're going to need a much greater response, that there has to be some response that says this is a supply of housing that we can now access that we couldn't access before. And also the healthcare that people need to access. I love Cohealth's suggestion of a housing and healthcare hub, because actually the reinforcing need that people's healthcare requires during this time has been very, very significant, because they have lost access to the services that they might have had supporting them, whether they were on the street or housed. And sometimes it's been the breaking down of that disruption that has led to them to being homeless again. So we all know that it's a system of care that we need to look at, a system of housing, how we can get involved in advocating around the supply issues and the affordability. We know that the people we work with predominantly can't afford the private rental market, but we know with a subsidy that could change. One of the things that has been clear for us is that we have also had lots of families involved in needing assistance, and we've also linked across the domestic violence sectors so that people weren't thrown into homelessness because of domestic violence but could access transitional housing. And I know every state is doing similar things, it's just our states all have particular ways of working that make some of those differences happening. But I think we can all reinforce our effort and our knowledge and our skills to say this is a moment in our history and time that we should really progress how we can make sure as few as people, if not any, return to rough sleeping or overcrowded situation or transiency in motels and cars. That, you know, there's no one form or one population group that experience rough sleeping. We know who the most visible are, but behind that are people in cars, people who intermittently stay with friends, people who are paying their own way in accommodation in hotels that are too expensive or boarding houses, and that we need to constantly make sure we make them visible. And, you know, of course, we know overall homelessness and housing affordability is a context that is of equal significance to a pandemic in health, and that people are dying. I mean, we don't actually know what other things are happening in people's lives, like suicide, overdoses. The data on that is something that we will see in months ahead, but we know many people are incredibly anxious, are incredibly distressed, you know, really desperate. I mean, just listening to people on the phones, that desperation, and I don't want that desperation to be transferred into, oh, people are just getting free accommodation. They're not. They're getting free accommodation because they don't have a home and they're trying to exist in conditions where they are more vulnerable to health and where they can't really address the pandemic issues. So I think that it's fantastic to be part of a sector that has decided that this is something we want to address and that we need to be very proactive in addressing for each individual, but also at a system, and that system is not just housing, it's not just health, it's not just unemployment, it's all of these things together. And that's the way forward, is working through a systemic response, as well as making sure we leave no individual behind who has to return to rough sleeping.
Thanks, Karyn. Well, opportunity for everyone there's been a bit of a frantic number of questions and we've had a few answers and those sorts of things going on in the chat, but please do feel free to throw in some questions online. I'm going to throw a few to each of our panel members now, but please do, the people online, keep coming them through and share your thoughts as well, as that'd be really appreciated. So I might, Paul, just jump back to you. There was a few questions I know you responded online, but could you just run us through those numbers again, that what you've been able to find? There was quite a bit of interest online. I got a few messages about that myself as well.
Yes, it's a precise number, but let's just go through some of the different state experiences. So from near my in New South Wales, they know something around about 260 odd rough sleepers in Sydney since the beginning of April, and they'd had some numbers in March as well, and the total estimate across New South Wales is probably around 2,000. In Sydney, in addition to those 260, another 439 people have accessed temporary accommodation. That's those beyond the rough sleepers. Victoria, 870 rough sleepers, we don't know the total number of those experiencing homelessness, have moved into temporary accommodation under programs funded by the Victorian government, and launch housing is being supported by other agencies like Sacred Heart Mission there. Queensland, you just heard a revised number. So a week ago it was 533 3 weeks ago it was 29, so Queensland's gone from 29 to 533 to 640, and over 300 of those 640 are rough sleepers. Western Australia was around 75 who received temporary accommodation. South Australia was 400 in total. Very nice round number. That's a precise number in South Australia because they have pretty good numbers there. A very nice round number of 400, many of whom are rough sleepers. So the majority of those are actually rough sleepers in Adelaide. And they do have a program to extend support beyond a very short period of time, and they have a very strong guaranteed program there to move people into public housing, in particular in South Australia. So that's an idea of numbers. And so basically what I'm saying is that there's at least 1,500, if not more, rough sleepers who've been provided temporary accommodation across Australia, and easily 3,000 in total. But it's probably well over that who've been provided with temporary accommodation. So that's an incredible platform on which to build. As you said earlier, those areas where they did have the by name list under the Advanced to Zero program operating, where they did know the health needs because of this thing called the VI-SPDAT survey, were able to react probably quicker than other areas, and had a stronger understanding of the group that they were working with. And we'll be able to track that group in particular very strongly going forward.
Great, thanks Paul for reiterating that to us. So I might just throw to the first of the questions we've got from online. So Corey Allen asked, do you think the experience of being housed for emergency reasons will translate in more willingness to move into longer term supported housing? Who wants to take that one? Karyn, are you looking like you keen?
Do you use the word willingness, Corey? I don't think we should place it on the individual's willingness. It's really what the system offers. And we need a range of housing options, not one size fits all. And we need to facilitate people's independence in the community with the services they need to support them due to their specific needs. So I would hope, and that requires us as a system to be more realistic about what we offer rather than focus on whether the individual is willing or not. Whether the system's willing or not to invest at this point in time, and whether we can translate it into some kind of economic stimulus, because we know that an economic stimulus is going to be needed for the economy, then this is an opportunity for that economic benefit to be realised as much as a personal benefit. But we've got to offer that range of housing options to people. Sometimes people say they don't want to be housed because there's only one option and they've been there and it didn't work. But we know from our work with people who are rough sleeping or homeless in any general way that the diversity of the population's personal needs is incredibly variable, and one size doesn't fit everyone. So, and I know local communities know that. I also just want to add that the figures you've got are mainly capital city figures. We don't know the figures beyond Brisbane, but we know that in regional and rural areas across Queensland, people have also been accommodated, but we don't actually know that figure. But I know Corey's passionate about the evidence and knows it's there, and that, you know, it's really about getting the political will to resolve the housing crisis as much as the pandemic crisis.
Yeah. Great. Thanks, Karyn. Did anyone else want to add to that? I think that, you know, we've talked a little bit in South Australia about this idea that, you know, you have failed tenancies, and that phrase, failed tenancy, actually puts all the onus back on the individual. And in fact, what we found when we dug into that is actually failed housing, that the housing option isn't suitable for almost anyone, certainly not for rough sleepers. And so it actually changed the emphasis on where the focus needs to be. So it helps with that kind of willingness issue.
Just on that, David, the failed tenancy area. So for the last 12, 13 years, we've been doing research on programs where people have moved from rough sleeping in the main to permanent housing. And right from the beginning, the tenancy sustainability rate has been incredibly high in these programs. So, for example, the Sydney Mission Australia Micah, MISHA project, there's too many M's going around here, but the MISHA project in Sydney around Parramatta with Mission Australia, what we saw there was something like 88% tenancy sustainability of those with chronic rough sleeping 3 years later. Sacred Heart Mission with the Journey to Social Inclusion program in Melbourne is coming up with a very high tenancy number for those provided with support under the Journey to Social Inclusion program. Generally speaking, the tenancy sustainability rates have been incredibly high, but they are with significant support. And so the idea is that if you do provide permanent housing, no, you don't have failed tenancies in the main. You have quite the opposite of that in the main. And that's a very important point to make. And it's something that we weren't necessarily expecting when we did that work. And that was coming in just after the Rudd stimulus package. So there was a number of homes that I saw that were really quite, new homes, which is fantastic. We can do the same again with the stimulus package. That was a transforming study, that a Housing First study from 2008, 2009. It wasn't called Housing First then, but that's what it was. And it was an incredible transformation. And it's been repeated on a number of occasions since.
Thanks, Paul. One thing that's been coming through online is just a bit more information about where the data's come from. So, of course, very important point Karyn just made, that we haven't been collecting data from regional areas. So this is not comprehensive. This is just what we know about through the Australian Alliances networks. There's been some questions about whether or not the data from Victoria, for example, is just from Launch, and largely the answer to that is yes. That's who's part of the Australian Alliance at the moment. But if you do know of other data, if you are aware of data that's been that people are collecting and we want to share that, Paul, I'm sure you're happy to receive feedback from people from different areas. So
yeah, send me an email. We're currently working with all those partners to just run through those numbers. The Launch housing number, for example, is a very precise number, a very good number from Victoria, and they were the key, the housing related side of that. Sacred Heart Mission and others came in with support. And that number in terms of rough sleepers into temporary accommodation in Victoria is actually quite, in Melbourne is actually quite good. But send me an email, paul.flatau@uwa.edu.au. Tell me your story. In WA, we know that down in Margaret River, they had a few people being provided with support.
So then put your details out after this call as well, just so that people who, when we do the follow-up email for this call, you'll get a slide deck from today. There'll be a link to the video that you can share. And we'll send details so that we can continue to build the number of people who are feeding into what data that we've got. And I'll mention later on, but we are having another forum in a few weeks that we've got the Federal Minister for Homelessness to participate in, and we'll be able to update the data and get a latest update then. So we're trying to build on this as we go. Sorry, Paul, for interrupting. Well, I guess there's a theme to some of the other questions as well, which is where's all the housing coming from? The $1 million question. So I'd be keen to get people's perspectives on that. I know that private rental was mentioned as an option earlier. So do each of the panelists maybe want to have a crack at saying what they understand is going on, where we think that the options for how do we improve the situation for housing outcomes for people who have been temporarily sheltered? Does anyone want to go first? Cameron, I might just name you. Is that all right?
Yeah, yes, sure. We've got a broken system. We need more affordable housing. It's a tremendous effort that we've got people off the streets immediately, and everything about that should be celebrated. And of course, we know that we can change our systems, and go back to the point that Karyn made, it really is, we've got to make sure that our systems are housing ready, not people are ready. So we can change our systems to ensure that those people who are temporarily accommodated in motels can access secure housing. But really, I don't even know if it's an elephant in the room. It's abundantly clear that the problem is a housing supply, affordable housing supply problem. And what we need to do is augment these excellent initiatives of getting people off the street with a massive injection into the supply of housing that's affordable, and of course, where necessary, with linked supports. We also know that, picking up on some of the questions online, that one example, the Queensland government, for example, has rented out a massive student accommodation building that's now vacant because all international students are still overseas. And it's supported people to move out of 3 large homeless accommodation buildings in Brisbane, and also a community housing building that has communal living. So there are a lot of things that the government's doing now to immediately respond to the suboptimal living conditions that they've been funding for many years. So it goes back to the earlier point that when we keep people homeless, we still spend an awful lot of money on them. So rather than keeping people in temporary accommodation for more than a crisis, we need to invest in the housing stock, not just disinvest in social housing, which Hal Paulson and others have showed Australia's been doing since '96, and at the same time increasing funding to temporary accommodation. We need to actually transform the investment so that money's going toward new stock on the ground and stock that's actually affordable housing.
Yeah, I think that's a very important point. And as I said, the RUD stimulus package, obviously coming in with the GFC, did provide this significant amount of permanent housing of very high quality. And it's exactly the sort of thing that I know that, you know, Kate and others are actually arguing for in terms of response right now. But I think in various places, there's been a pretty good connection between the homelessness services and the housing authorities for public housing. And the transitions that are occurring there, building on programs like 50 Lives in WA, or the Journey to Social Inclusion, these kinds of programs, the Brisbane programs, where they've already got the connections, where state housing authorities are really looking around at the moment to provide that spare accommodation. They're buying accommodation, and I'm sure Kate can extend this out in terms of everybody's home. And what we can do taking this forward in terms of housing supply.
Yeah, Karyn, did you want to say, I think, like, we all agree we need more housing. We need the government to put an investment in here. We think that, you know, stimulus program like last time would be wonderful. Even if we got that right now, the houses won't be built in time to take all the people out of hotel rooms and into housing. What role do you see as private rental? You know, subsidies, like, and what have you seen that's working well around the country?
Well, I think there are research programs and pilot programs that have been done that are about private rental subsidies with support, that people won't survive in the private rental market or the private, you know, rental framework. There'll be some that will be fine. In the homeless population generally, you know, there's plenty of people that only need affordable housing. They don't need support. But for those of us that are working with the people who need healthcare and need community services, we know there's just been so many programs that have been researched to show the value of connecting up support, whether it's on-site or outreach support to people's homes in sustaining tenancies. You know, there's lots of them. We just don't go to scale with these programs. So across Australia, we've got both, you know, supportive housing on-site buildings, and we've got scattered site. All of them demonstrate the key components of connecting up tenancy sustainment with community services and healthcare when needed. So we need to go to scale rather than, I think far too much debate goes on whether one program's better than the other. They all have the same elements of good case management, responsiveness to the tenants, understanding tenancy obligations, coordinating with tenancy management and community services, and when necessary, integrating healthcare. So we just need to go to scale on these issues and stop just doing pilot programs. And if there's issues about, well, what's economically, what's the best price for this or the best investment into it, we should be problem solving. But I also think governments should really relook at it just seems to come to an impasse about solving affordable housing because everyone says it's not their responsibility. It's actually everyone's responsibility, and it's time governments change their policy settings across local, state and Commonwealth. Like we've seen amazing work done in this pandemic. We should change the policy settings to make sure that we can get more community housing so that there's more community housing can leverage what they've got and have government invest in their ability to build, as well as public housing and private rental subsidies.
Great, thank you. I might jump back to you, Nicole. We had a few questions in the sort of health space. One came through was about what policies would help hospitals strengthen their response to homelessness. Have some responses to that?
Sorry, David, would you mind just repeating the question?
Yeah, so the question we got through was what policies would help hospitals strengthen their response to homelessness?
Look, I think there's a range of policies that we can look at, and I suppose where I would say the emphasis needs to be is really on supporting the sort of community sector or the primary care sector to be able to provide a local health response in the community, and that we're actually working to support people where they are, manage their health conditions and prevent them from getting to hospital. So a lot more prevention, early intervention services, linking people into good treatment services and preventing them from going to hospital. We know that once people reach hospital, that the cost of care increases significantly. The length of time that they are required to spend in hospital care also increases, and the outcomes are poorer. So we really want health policy that focuses on investment in primary care, early intervention services that prevents people from making those presentations at the emergency department.
Yeah, great. And while we've got you, Nicole, I thought one of the other questions that came through was, what, if you have any reflections on the impact that I guess COVID-19 and this year's flu season will have and how we respond to homelessness and the combination of those two things?
It's a really interesting question. With the social isolation in place, we've actually to date experienced much lower incidence of cold and flu. With restrictions easing and moving into the height of winter, you know, it is possible that we'll see an increase in cold and flu again. So it is dependent a little bit on the social restrictions or the social isolation and what remains in place and for how long, as to whether we see an increase in cold and flu. But that's really, I suppose, what the strategy is in protecting the health system. It's to manage, contain the pandemic, but also in doing so, we're also providing a response to cold and flu. So it's a bit crystal ball, really, unfortunately. But it will be, you know, I know health services in Victoria and Cohealth is still planning for a spike in cold and flu, but also thinking that there may also be a spike in COVID-19. So preparing for that and hoping that that doesn't occur, of course.
Yeah, great. I've got a question here from Julie. Julie Douglas says that some local councils are wanting to explore their place in developing local solutions to homelessness in their regions. What role do you guys see as the role for local government in responding to this? Does anyone want to put their hand up for that one? I'm going to throw to you. Karyn, you've unmuted.
I said local government can build housing just like anybody else. I think looking at what are the ways that local governments can be involved is really critical, and that they're as important as any level of government. I mean, they own land, they have a lot of the planning. I mean, I think other people after us could speak to that a bit more, Wendy and Kate, but I think there's been lots of work done about inclusionary zoning, things that the local governments can do, whether they can even get involved in building. You know, I think the research has all been done. It's just time that people actually put it into practice and not just keep talking about it.
Yeah, and I think there's a really strong role for local councils in advocacy and helping to I guess, pull on the point that Karyn was saying before around different levels and different arms of government working together on this problem. Local councils have a role to bring some of that together. We haven't brought Kate Colvin and Wendy Hayhurst from two different speakers we're going to have shortly, but I think you guys probably want to jump in on this question. So, Kate, did you want to say anything on that one?
Karyn said exactly what I was going to say, that local government can have a really important role getting housing going locally, using their planning powers, using their land, using partnerships with state government.
Is that a ditto from you, Wendy? You're muted, by the way.
Can I jump in, David, with a quick response to that to follow up?
Yeah, Karyn, you jump in and then Wendy will come back to you. You're just muted, by the way. Go, Cam.
Just supporting what Kate said, in London, the City Council gives an expedited planning approval if the developer commits to having an affordable housing allocation in a development. So there's lots of things that councils can do, big and small, in the way that Karyn and Kate suggested. And I think the London is a terrific example of what we can do in Australia.
Sorry?
I was going to jump in there also, David, but there's also a great example of that work, Cameron, with the City of Melbourne here in Victoria, who have a project called Make a Room, where they're actually looking at actually the council itself providing the accommodation and then building a support system around that accommodation to support people that are living there. So I think councils, there are really great examples probably across Australia of where councils are actually stepping in and taking an active role in the issue.
Wendy.
Yeah, I'm going to try, but I can't. You need to unmute.
You're
unmute my telephone.
You're all unmuted.
You need to unmute my telephone.
We can hear you. We might come back to you, Wendy. Magella, if you can help with that. I guess I get another question from online as well, which is, what supports do you know that are in place for international students, asylum seekers, refugees and others who are at risk of homelessness and aren't eligible for government's access to services such as a whole range of services? Have you seen anything come across your role, Nicole, in relation to that potentially?
Certainly in terms of refugees and asylum seekers. So that's an area that Cohealth has been doing some advocacy work, and we've partnered with ACOS, the Australian Council of Social Services, to raise the issue of the lack of support that's available for refugee and asylum seekers. And we've been advocating to the federal government that this community, again, another disadvantaged, marginalised community, is also included in the relief packages that are available. So ongoing advocacy happening in that space.
Cool. Karyn, did you want to add any more to that question? Or Paul?
Hold on. Local groups are looking, and certainly the people haven't been excluded from the immediate response to accommodation so people can self-isolate, which, I think was a really great initiative of the Queensland government to include them, and we need them to be included for as long as the social isolating conditions apply. But then there is the issue about what support people need afterwards. We've been in touch with the international student groups, but we're letting them know what services they can access, and basically if it's a COVID response, we're including them.
Great, no, it's good to hear. Well, I think we might throw to our next speakers and talk about the call to action, if that's all right. And so we asked Wendy Hayhurst from the CEO of the Community Housing Industry Association to talk about a proposal that she's been working on that would, I think, help in this situation, what we're talking about. So Wendy, hopefully we've got all the tech issues worked out. I can see you fine. It looks like you're unmuted. So do you want to have a chat to us about this Rapid Housing Response Fund that you've been working on? And feel free to jump in with any reflections on the conversation we just had before as well.
I don't know whether you can hear me.
Yeah, we can hear you, Wendy. Can you hear us?
I mean, I don't think the computer audio is working because I can't hear anyone.
We can hear you, so you want to go ahead. Kate, we might come to you then. I think we're still having some challenges with Wendy hearing us, if that's all right. So I might jump to you, Kate, and you can talk a bit about the work you're doing. You're just muted as well, Kate.
It's great to see everyone, and look, it's been a really fantastic conversation. I guess where I fit in, where Everybody's Home campaign fits in, is that we've got all this great service delivery happening around the country, and getting people off the street, and getting people who are homeless into accommodation. And then we've got academics who both now and, you know, for many years have been making it clear that when we can actually house people who are homeless, the outcomes for them are better, the costs to the government are better. And I guess the missing piece that we don't have is that we don't have government who are willing to hear the evidence, understand the practice, and actually deliver the housing that's needed, both to make sure that people who are homeless have a home to go to, but to also make you know, the homelessness system, the health system work effectively and make our communities safe. So I guess at this point we've got this amazing opportunity. It's not, I wouldn't really want to call it an opportunity, but it's a moment in time in which I think the public are finally understanding just how connected housing and health are, and how vulnerable people who are poorly housed were when the pandemic hit. So we have seen a lot of attention to the vulnerability of rough sleepers, and that's very important. And it's great that people have been moved into accommodation. But I think one of the speakers earlier mentioned also the extreme vulnerability of people who are in overcrowded housing. You know, you have one person in that situation contract the virus, it's very easily going to spread to the rest. So to fix both of these problems, to make sure that we don't end this winter and then turf people who are safely accommodated in hotels back into the street, and make sure that we can long-term fix the kind of conditions that mean that people are in overcrowded housing. We do need government to invest in social housing, and I think a few speakers have spoken to the importance of that. But to get government to act, we need to really take action as a collective set of organisations and individuals to put that pressure on them. So that's where Everybody's Home fits in. So we've launched an action today, which I think, David, if you stop sharing your screen, I can share with people, which we're inviting people to, so can people see that? So we're inviting people to sign this petition. So this is just one example of an action that we ask people to take to connect the individuals in the community to government, so that government feel that encouragement to take action. But for organisations, I just see where I'm clicking on the link here on the website, we ask organisations to join the campaign as a campaign partner, because today's petition is just one example. So you can just scroll down there and you join up. It's just one example of the type of action that we use to connect individuals in the community with government and put that pressure on government to act. As we move through the campaign, there'll be many other opportunities and also coordination of lobbying effort from community sector organisations. So that's where it's important to connect with the campaign as an organisation, so you understand that deeper level of activity that's happening. So I'm happy to take any questions, but I'll leave it there for Wendy to talk about the particular proposal being put forward to government.
Great, thanks, Kate. Wendy, can you hear us? And she'll try one more time, see if we can get you on.
Yeah, I'm very sorry. I've got very unstable internet connection. So in the previous call, people actually couldn't hear me. So I joined by phone, but obviously there's some difficulty in muting that. So you'll just have to wave at me if I go. So thank you. It's great to see that many people on a webinar. I don't think I've done one quite so big. And it's a great opportunity. I was invited to talk about one particular initiative. I want to mention two because they're both related. There's been quite a lot of questions already about the dearth of social and affordable housing that we have across Australia. So you won't be surprised that the major ask that we're working on collaboratively, it has to be said, with Homelessness Australia, Everybody's Home, National Shelter, indeed anyone who'll work with us, is to, I would say, emulate big time the last social housing stimulus we had back in the Rudd time. So next Tuesday, with Everybody's Home and Homelessness Australia, we'll be publishing what is our plan. It's not going to be enough to solve the shortfall, but it will give it a kickstart. So we're looking at a programme of 30,000 units over the next 3 or 4 years. And we're recognising that to get this through, we have to advocate not just for the houses that this will bring, but also the jobs that it will help create. And we're looking at 4 waves of activity, including doing some backlog maintenance, because let's face it, quite a lot of social housing is expensive to run for tenants, and it's not in very good condition. And we know we can ramp up and do that very, very quickly. We're talking about acquisition though of homes that long-term are suitable for people, not just taking what's off the shelf because it's cheap, but it's going to be costly in the future to maintain. And thirdly, we want new housing, brand new housing, additional housing, because if those people we're talking about, particularly today, are going to be housed safely and securely, and we're still going to continue to house those people who are poorly housed in private rental, we need lots more. But we do recognise what one of the speakers said, well, it takes a while for the stimulus programme to get going and units to get put on the ground. That's very, very true. So again, with Homelessness Australia, and I must admit, because Jenny and I had been meeting with Luke Health on a number of occasions, and on one occasion, he said something that made me think, right, I'm really glad you said that, because he said to us, so what happens to these people in TA after 6 months? And you're thinking, yes, Minister, what is going to happen to all those people? We can find them accommodation, but at what expense? So the second proposal we put forward is not ideal. It's not something we'd argue for if we had loads and loads of housing. It's taking an opportunity to build on some really good work by specialist homelessness providers and community housing to use a private rental system to head lease properties to provide the support that's required to help people sustain their tenancies. And these programs exist throughout Australia. Bridge Metro and Women's Housing run one with NIAMI in Sydney. They can be ramped up quickly. We know there's plenty of empty homes out there from people vacating, going back home, students or whatever. And we know many mum and dad investors don't really want to sell just at the moment. So we think there's an opportunity there. So that's another program, a small scale program, we think 25 million a year for a couple of years, to actually fill that gap before, and I'm optimistic, we can start that social housing the ground. Thank you.
Thanks, Wendy. We got a little bit garbled towards the end there, but I think we got the gist of what you were saying, which is optimistic we can get this stimulus program off the ground. So thank you very much for that. I guess just there's been a few more comments coming through, and please feel free to send them through. What we run out of time for today, we can online as well, so people do send them through if you've got thoughts and things you wanted to share. There's an interesting one that came through, Kate, where you were talking. What do we need to do to be able to communicate with Conservative governments? They have an ideological position about helping people they see as lazy or not trying. So what's the influential attitude shifts we need to make there?
Look, I think one of the things is what Cameron was talking about earlier. Sorry, it might have been Paul. No, it was Cameron, I think, about how it saves money to, get people into accommodation. So I think sort of highlighting that budgetary impact. But one of the things that's a really important message coming out of the, as we come out of the COVID-19 crisis, is that our economy is in tatters, and building social housing, as was shown when there was a big building program after the global financial crisis, is an incredibly effective way to get Australians working. So it delivers this social benefit, it reduces costs in the health system, it reduces costs in many other social services areas, plus it gets Australians working and gives people, the opportunities they need. I mean, I think another kind of frame that we can use when we're talking to government is, I suppose, the importance of housing to give people opportunities to do other things that are sort of valued or important in the community, like engaging in education and engaging in employment. But with those arguments aside, I still think it's always really important to just highlight how important housing is just to community well-being. And I think particularly at this moment when the community is so conscious of how, when it really comes down to it, as a whole community, our health as individuals and as the whole community is so important. We're really a community of people who rely on our, health and well-being to get through. And so I think that the baseline messages of how critical housing is to our health are important as much as the arguments about the economy and about, saving money.
Great. Well, we might jump back to the whole panel if that's all right. Another question we just got through was, what's the role that police can do in helping to resolve the situation of homelessness, generally, but in light of the crisis as well? Obviously, we might have a few police officers on the call, people from police forces. So does anyone want to jump into that one?
I'm happy to. I think that police have a vital role in linking people to services and not finding people who already have significant spur debt. The police certainly have played a role in linking people who needed to be accommodated, and we appreciated that they did that because they were out walking the beat to find people if they were congregating. But instead of that, however, I do think we'll probably find homeless people did get, fined. Indigenous populations, how many of them are now carrying a fine? So I think that it's really critical that law and order is placed in the context of supporting our community well-being and prevention of, those interventions that are going to put people into further debt, but also that police in their work show that they're interested in people's community well-being and work closely with housing and healthcare providers, because if they work closely with us, the gap between people falling through the system does decrease. And when you talk about who gets the benefit of housing and homelessness response, the justice system is a significant system that benefits, as well as the health system. So I think it's really important that we maintain vigilance, that police aren't over using their powers to penalise homeless people, but that they are part of the system that connects people with the right service at the right time, and that they respect, that people respect that people just aren't, it's not just their individual fault that they actually are in the situation they're in.
Cool. One other thing that's come through, and this is probably a pretty easy answer, but maintaining the current rate of the job seeker rate would help reduce the push of more people into homelessness. Any reflections on that from the panel other than, yeah, it's a no-brainer?
Yeah, I think it's obviously a critical point. Really, when you look at homelessness in a longer-term structural sense, the connection with poverty is fundamental. Very nice work done in the UK on that, around the connection between poverty and its long-term consequences in terms of homelessness. It is possibly the largest driver, and you know the various mechanisms by which that occurs are important to understand. So, for example, if we look at lifetime homelessness, intergenerational homelessness, you see this relationship between poverty and then its impact in terms of stresses and family domestic violence, which then generates often that first onset into homelessness. So it is a fundamental driver. You know, in our intergenerational work on homelessness and most studies that we've ever done, we come up with a very simple figure, which is that amongst those who are currently homeless as adults, half of them first entered homelessness prior to the age of 18. A significant number of them were in families which they identify as having an experience of homelessness. The first entries into homelessness are occurring amongst children and teenagers, largely when they run away from home or are thrown out of home. And the key factor there is violence in the family home. Where does that come from? Number of different sources, but poverty is a significant driver. And poverty is a driver not only in that kind of context, but poverty is a driver in terms of an economic, financial entry into homelessness via evictions and via the inability to pay rents and all the rest of it. And it's often going to be represented not in terms of immediately street rough sleeping, but it may be represented in terms of people living in their cars, which is the last thing they can maintain. And those cars are typically not in the inner city areas. People who live in their cars will try and find some other safe place outside the inner city so they don't get picked up always by the inner city services. But they are picked up by councils, and that's where, you know, coming back to councils and police, they can be supportive in that kind of world. You know, don't put the lights on these people. Literally, I mean, don't throw them out. Don't cause them to leave a safe place because you just don't like the idea of an abandoned car in your local council. So there are some of the ways in which poverty feeds itself into homelessness structurally, and the evidence around that in terms of longitudinal studies is pretty good as well, pretty strong.
David, can I make a very brief point, please?
Okay.
Everything Paul said was spot on. I just want to add to that and tie it to the earlier comment about how can we convince conservatives to do something about it. And I think the COVID response to the unemployment benefit is a really clear example of an opportunity. And late last year, Prime Minister Morrison said he's not going to raise Newstart for the millionth time, and he said, I'm not going to engage in unfunded empathy. Of course, COVID came and we've seen an increase to essentially Newstart that we've never ever seen before. And there's lots of reasons for that, but one is about the problem framing. We didn't want to raise Newstart because they're seen as the other. They're the unemployed bums that should do some work. Whereas now, this is just normal people who are out of work and we need to respond. So I think it's an important part of framing the problem in terms of what is unemployment, what is homelessness. You know, is it a problem of the individual and their the problems that they inherit innately, or is it a structural problem? And of course, we think in terms of structures, but we need to ensure that we're framing the problem in those terms, and that lends itself to a response that we've seen similar to COVID.
Could I say something as well?
Yeah.
I mean, I agree with what Cameron said. And I mean, I just want to say, Cameron, I always use your stats in most of the submissions I ever make, you know, to point out the stupidity of not investing in housing. We're trying to go ourselves with a group of others, including National Shelter, but also colleagues in Property Council, to talk about the reframing of the problem in terms of it does impact on individuals, but when it impacts on so many individuals, it has an economic impact. It has an impact on productivity as well. And people paying too much rent, paying too much mortgage, don't spend much in small businesses, they don't spend much on services, and they eventually don't have an asset and they retire into poverty and claim the age pension. So what we're trying to do is build up a group which we're calling the Housing and Productivity Research Consortium, to actually not to do one piece of work. We have done work, but we've done it in isolated chunks, and it sort of gets launched and then gets lost. So this is at least a two-year program of research. We've just got the funding to kick off the first one, which we hope to start in May. So we want to build that argument, which echoes well, we think, with all sides of politics, because let's face it, both sides of politics have issues about spending sufficient money on social and affordable housing. So that's something I hope you'll be inviting us back to speak about, perhaps in 6 months or so, when we do that first bit of work.
Great. And Wendy, while you're talking as well, I just wanted to follow up from the presentation you gave before. What, if you're saying to all the people listening to this call, what can they do to help with the work you're doing in that, helping us get additional housing stock into our national system? Is there, Kate was very clear about the sort of actions she'd like people to take. Is there anything people can do to help your work?
Yeah, well, I mean, join Everybody's Home, first of all. If you haven't already joined Everybody's Home, that would be the first thing. We're going to be launching it on Tuesday, all being well. So echoing it, and you've got your contacts, you've got local MPs, and sort of getting out that message, isn't it? We've seen quite a few people start to talk about it. Master builders were talking about it earlier this week. We had the CEO of BlueScope even raising it in a meeting with Frydenberg, a video conference with Frydenberg. So it's building momentum, isn't it? So let's just keep on talking about it. One other thing we want to do, it's going to take us a few more weeks, but we're hopeful to get some resource to be able to look at the economic multiplier effects of investing in social and affordable housing, repeat the work that was done by KPMG on the social housing initiative there. So that means that we'll have in a couple of weeks some messages to say as well. But don't let them off the hook. You know, we launch things and then we just got to keep on going, haven't we? But individual MPs, get them to talk about it as well.
Great. Well, thank you very much for all of those speakers and for your contribution there. That's really appreciated. I just wanted to say the last couple of things before we wrap up. This forum was really about how do we make the economic and health case. And one of the things the Australian Alliance we're seeking to do is to really build the connections between the health system and the homelessness systems around Australia. And so one of the ways we're seeking to do that is to set up a health network. There's a little bit of information about what it's trying to do on the screen now, but if you're interested in being involved in that, please get in touch with us. We're really trying to build that network up, and we're having a bit of an online session, just a consultation session about how we design that with a few people in the next couple of weeks. So please get in touch if you're interested in being involved. Also some information online about resources, people who are working in the sector, about useful resources that are out there. We'll share this in the post email summary that we're doing from today. We've also set up a Facebook group to share information about the stories of success and things that are doing in the rough sleeping space, which is the focus for the Australian Alliance, and encourage you to join that if you're interested in those sorts of things. Sorry. And our next forum. So we have another one coming up in a little while, in a couple of weeks, and I haven't.
Hello, everybody. It's Tim Richter here.
Oh, sorry.
Of the Canadian.
I think I just clicked on one of the links to that last slide. Sorry about that. So the next forum is coming up in a couple of weeks on the 11th, I think it is. Sorry, I should have put it on the slide, but the 12th of May, sorry, in the morning. And we're lucky to have the Minister of Health to come and join us, be part of that. We've got some representatives from local government who are going to be part of that as well. We're asking some of the other states and territories to be represented. I'm conscious of some of the questions we got from today's forum were about regional areas, and we have been very capital city focused. That is a reflection on some of the membership as part of the Australian Alliance at the moment, but it doesn't mean we're not thinking about regional areas, and I'll have a think about how we can make sure the voice of regional Australia is represented in our next forum as well, and give you a bit more of the conversation than it has been today. But we do hope you can join in that next session that we've got. I think an important conversation to be had with the role that governments can play in, of course, improving and increasing the amount of accessible housing that we have accessible to deal with the responses that we're dealing with at the moment, but also in relation to the focus the Australian Alliance has, which is really how do we make existing systems work better, and to put the people who are sleeping rough at the heart of those systems through the work that we do. So we hope you can join us for that next session. And thank you to everyone for being here. Thank you to all of our panelists. Thank you to the team at Micah Projects for helping organise all the technology, and for 50 Acres organisation for helping support the communications around this event. And one thing that I've taken to doing is fragrantly copying the inspirational or confronting messages that the Canadian Alliance to End Homelessness do in all of their events. And I thought I would share this one with you today, which is that if it's important to you, you'll find a way. And if not, you'll find an excuse. So never give up on the work that we're doing. It is so important. There are solutions out there. Thank you for your time today. And we look forward to seeing you at a future forum in the future. Thanks, everyone.